Mr. Deputy Speaker, sir, like many countries around the world, our fight against COVID-19 has been difficult and full of ups and downs. The latest outbreak is a major setback for all of us. Many have been surprised at the size of these new clusters. It shows how easy it is for the Delta variant to spread and cause large outbreaks with the potential to overwhelm our hospital system. Furthermore, in a mixed population of vaccinated and unvaccinated persons, we are more likely to see large clusters because vaccinated persons can be infected but experience very mild symptoms. Consequently, they may not realize they are infected and inadvertently become asymptomatic carriers. By the time the cases pop up, days or even weeks would have passed and the infection would have spread to many people. Because of these large clusters, we faced a heightened risk of widespread community transmission before we attained adequate vaccine protection. We must remember the proportion of people with 2 doses and with 2 weeks after their second shot is still less than 50%. This is when we moved into the heightened alert. And we are especially worried about our seniors, because there are still over 200,000 seniors above age 60 and above who are not fully vaccinated. If they catch the virus, many will likely become severely ill or even succumb to the infection. And that's why, as you heard just now from my co-chairs, the MTF made the difficult decision to scale back activities and return to phase 2 heightened alert. This will help to slow down transmission in the community, and crucially, this will give us time to push up vaccination rates further and protect our seniors. I know the restrictions have caused much inconvenience to everyone. We seek your forbearance and understanding. I hope our explanations will help you understand why we had to reintroduce these painful but necessary measures to protect our seniors. We also know these measures will be difficult for our workers and businesses. And that is why MOF announced a new $1.1 billion support package last Friday to cushion the impact. I will elaborate on this in my statement later this afternoon on the supplementary supply bill. And we hope the support measures will help affected workers and businesses tide over the heightened alert period. As we bring the current outbreak under control and continue to speed up vaccinations, we will be able to get our reopening plans back on track. The key is to open up at the correct juncture. Some countries have decided to open up fully even though their vaccination rates are less than ideal. For example, the Netherlands lifted all restrictions when 45% of its population was fully vaccinated. Cases surged tenfold to an average of 10,000 a day within 2 weeks. They have since reimposed restrictions. The UK has about 55% of its population fully vaccinated, although its coverage of its seniors is much higher at above 90%. It lifted all restrictions on 19th of July, its Freedom Day. Cases surged to 50,000 a day, more than 2/3 of its peak in the last wave, and are likely to rise further. Hospitalization and death rates are starting to creep up again, almost entirely amongst unvaccinated individuals. We are watching what's happening in these countries very closely. What is clear to the multi-ministry task force and our medical advisors is that we should be very careful about lifting restrictions when a significant proportion of our people are still not fully vaccinated, especially our more vulnerable seniors. While other countries may have come to terms with a certain level of COVID-19 cases and even deaths, this is not the choice we want to make in Singapore. Here, we look out for one another and we take care of each other. We do not want to see large numbers of COVID-19 patients in intensive care, on oxygen supplementation, let alone succumb to the virus. So we must give our fellow Singaporeans more time. Today, many younger Singaporeans are still waiting for their second doses of vaccines. And many of our seniors who had been hesitant about getting vaccinated are now starting to step forward. So we will see continued improvements in our vaccination rates. At the same time, there is no need to wait for everyone to be vaccinated before we begin to open up. That would mean holding back the entire reopening timeline until much later in the year, which is not tenable. So what is our approach? Let me explain. We will synchronize our reopening with our vaccination coverage, not just of the overall population, but also amongst our seniors who are the most vulnerable. And we will do so in a series of controlled steps. So this is what we can all expect in the weeks ahead. In early August, at the midpoint of the Phase 2 heightened alert period, we plan to review the current set of measures. We will assess the overall infection situation. We will also monitor the status of the infected cases to confirm that the link between infection and hospitalization has been weakened by the vaccines, like in the chart just now which Minister Ong showed. Importantly, by then, 2/3 of our population would have received 2 doses, and we would have vaccinated about 3/4 of our seniors aged 70 and above. So if the clusters are under control and hospitalization rates remain low, we will be able to ease some of the Phase 2 heightened alert measures. But the easing will be differentiated and extended to only vaccinated persons because they are much better protected against the effects of the virus. This means that if you want to attend a large event or a religious service involving more than 100 persons, you have to be fully vaccinated. If you want to go out to dine in a restaurant or work out in a gym, you have to be fully vaccinated. By around early September, we expect to vaccinate about 80% of our population with 2 doses, and we hope to cover a similar proportion of our seniors aged 70 and above. We will then be able to ease the restrictions further, including allowing larger groups to get together, especially if they are fully vaccinated. We will also begin to reopen our borders, especially for vaccinated persons to travel. We will start by establishing travel corridors with countries or regions that have managed COVID-19 well and where the infection is similarly under control. So fully vaccinated persons will then be able to travel to these countries or regions without needing to serve the full 14-day stay-home notice in a hotel when they return. Depending on the risk level of the country they visit, we will either replace the SHN with a rigorous testing regime or shorten the SHN to 7 days at home. And this will allow vaccinated persons to travel more freely. Those who are not vaccinated can still travel, but will be subject to the prevailing SHN requirements. Beyond that, we will continue with a series of progressive easings. As we do so, we must expect cases to rise, partly because there is still ongoing cryptic transmission in our community, which can easily break out into new clusters with increased activity levels. Also, as we open our borders for people to travel without SHN, we will see more imported cases and infected persons slipping through from time to time. But at that stage, as you heard just now, our main focus will no longer be on daily case numbers, because the vast majority by then would have been vaccinated, and even if they catch the virus, they are much less likely to become very ill. Instead, our focus will be on the much smaller number of infected persons who need supplementary oxygen or require intensive care. So at each stage of easing, we will monitor the health outcomes, especially the hospitalization and ICU cases closely. We will ensure that these remain acceptable and stable before we proceed to the next step. But if hospitalization cases or worse, severe illnesses were to shoot up, we will have to be prepared to slow down or even pull back. In particular, we have to expect new variants to emerge, which may be more transmissible, more lethal, or more successful at evading the present vaccines. We will find solutions to these variants, especially through booster shots or updated vaccines, which we may need to roll out nationwide. but we must be prepared that the new variants can lead to more severe outbreaks and may well force us to introduce restrictions again from time to time. In short, there are still considerable uncertainties about how the pandemic will unfold globally. But our best bet is to push ahead with a high level of vaccine coverage for our people. This will give us the best chance to resume more normal lives while keeping our morbidity and mortality rates low. I've provided an overview of the roadmap for our transition to a COVID-resilient society where we learn to live with COVID-19 as part of our daily lives. The MTF is still fleshing out the details, and we will share more when ready. I assure everyone that we are committed to seeing through these plans. The current heightened alert is a temporary, limited timeout. With better vaccination coverage, we will soon be able to resume our plans to reopen progressively while keeping everyone safe. But I underline, vaccination is key, especially vaccination for our seniors. If many among our seniors are not vaccinated, we will continue to worry about our hospitalization and ICU cases, as well as fatalities. So I make a special plea to all who remain unvaccinated or have not registered to be vaccinated, especially our parents and grandparents. Please come forward. And if you can't get out of the house, we will send a team to your homes for the vaccination. As part of our controlled and phased reopening, safe management measures will still remain relevant and important. Basic SMMs like keeping a safe distance from others and wearing a mask can help reduce transmission effectively. So we must stay disciplined and continue to maintain these practices even as we transition towards the new normal. For example, we would probably not want to do away completely with our mask requirements. We may consider dispensing with masks when outdoors, but it would still make sense to wear them in an indoor, enclosed environment where transmission risks are greater. So this may well be one of the last rules to go in the new normal. At the same time, we will continue with our regular enforcement checks and take strict actions against any breaches of the rules. Several members have asked questions about this, especially how our nightlife establishments are monitored. And I believe Minister Shanmugam will be sharing more on this, especially efforts by MHA and the police later too. But let me just say that our enforcement agencies are doing everything they can in very challenging circumstances. Since April last year, a multi-agency task force comprising various government agencies, including the police, have been coordinating the enforcement of safe management and safe distancing measures in public venues, including F&B outlets and massage and spa establishments. They have been doing daily enforcement checks. Where laws were flouted, offenders, both operators and individuals, have been taken to task and cases publicized. Our SDAs and enforcement officers will continue to do their best, and we should give them our full support. Most importantly, we must all do our part and continue to exercise individual and social responsibility. We cannot rely on enforcement efforts alone to get us through this pandemic. Our society will be much safer if we demonstrate social solidarity and a collective sense of responsibility to do the right things together. There are a few simple but very effective precautions which we should all incorporate into our daily routines. And we've said this probably like 1,000,000 times, but I think it's worth repeating. Practice good hygiene. If you're not feeling well, stay home. See a doctor and get yourself tested. Do so even if you are vaccinated. Remember what I said earlier at the start, that vaccinated persons can get infected and may feel very mild symptoms or even no symptoms. So even if you're feeling unwell, vaccinated, feeling unwell but very mild symptoms, get yourself tested. If you receive an SMS alert, come forward to be tested as soon as possible and minimize your social interactions until you have a confirmed negative test result. There is really no excuse not to be tested, since testing is now more affordable, accessible, and convenient than it used to be. and will continue to be so in the future. The antigen rapid test kits, the self-test kits are widely available at all general retailers now. If you buy in bulk, it's cheaper too, so you can buy a few and have it at home. The MTF is also distributing these test kits to households. We are starting with those who live near markets where large clusters have been identified, and we will progressively scale up and distribute to everyone in Singapore. And as you heard just now, we are also rolling out new methods of testing, be it wastewater surveillance in our estates or breathalyzer test at our checkpoints. And now we have the breathalyzer test in Parliament too before each parliamentary session. So regular testing and the social consciousness to get ourselves tested regularly will protect us and keep us safe as we transit to the new normal. Mr. Deputy Speaker, sir, we are all disheartened and upset when we hear of people breaking the rules, acting irresponsibly, and causing new clusters to break out. But over the past year and a half, the vast majority of Singaporeans have shown tremendous discipline. Many have also been working tirelessly in our fight against COVID-19. It's not just our healthcare workers like our doctors and nurses at our hospitals, clinics, and community care facilities. It's also our fellow Singaporeans on the front lines elsewhere, some in less expected settings, others in less visible places. They include our safe distancing ambassadors, food delivery riders, cleaners, and many more. They work hard to keep Singapore going and to keep all of us safe. Like Mr. Lok Chun Kiat, a cleaner with CBM Private Limited. He attends to high-risk locations where positive cases have been detected. The cleaning work that he does is not easy under normal circumstances. But now, with the exposure to the virus, he and his team have to put on full PPE and adhere closely to stringent procedures while they work. It's because of people like Chun Kiat and his team that we are able to quickly deep clean our infected premises and minimize the risk of fomite transmission. Or Ms. Siti Zulaina binti Muhammad Said, a senior medical technologist with the National Public Health Laboratory at the NCID. She leads the team to investigate outbreaks and undertake testing surveillance. It's mission-critical work that requires long hours, stretching into weekends and public holidays. You can imagine the load coming through recently with the surge of cases we've had in the community. It's because of people like Siti and her team that we are able to detect and ring-fence infections early. There are many more Chun Kiats and Sitis out there, many more unsung heroes and heroines quietly and steadfastly contributing to our fight against COVID-19. I'm sure the entire House will join me in saying to all of them a big, heartfelt thank you. Sir, these actions of our fellow Singaporeans inspire us and give us confidence and hope that we will get through this together. We are all disappointed by the latest outbreak and the heightened alert restrictions, but we will recover and bounce back. It's always darkest before the dawn, so let's be strong and keep the faith. The dawn is coming. Let's approach it with renewed strength as one people. Thank you, Mr. Deputy Speaker, sir.